All right, well, let's just get to it. We're
Yeah.
going to get with the first thing that you tell everybody they need to do. So take some notes here. You say, to start off, a minimum of 70 ounces of water per day.
Correct.
Why so much water, and does coffee and tea count?
Okay, good question. First of all, as most people eat when they're hungry, especially now that it's getting warmer, is folks don't drink enough, so when the body is dehydrated, you actually perceive hunger. So a lot of reasons people even eat is going to be because they're thirsty. Okay. So the first step is if you doused yourself with water consistently, your hunger reduces, and then you're dealing with actual hunger instead of just dehydration.
Okay, and the coffee and tea issue for people who need to have their 5 cups a day?
I encourage, after 15 years of practice, I know that when I remove coffee, people threaten my life. So I've decided that if we reduce it to 1 to 2 cups a day and keep it there, then that's decent. But remember, those are dehydrating. Right. And so they make you go to the bathroom more, they make the kidneys function more greatly, which has a benefit, but it's dehydrating.
So if you have the caffeine from the coffee or water or tea, replace it with extra
Correct.
water.
So 1 to 2 cups, and especially if you're trying to lose weight over a shorter period of time, if you remove coffee or tea, you're going to have a lot of headaches, and that makes people even more grumpy. So of course, they're less likely to follow through. So I usually keep 1 or 2 cups of coffee.
Okay, I like the next thing because this means we're not going to have to starve ourselves to do it. Eat 5 times a day. You say unlimited veggies. So if we're eating 5 times a day, what should we be eating, and what about fruit?
Okay, well, what I'm going to recommend always is twice as many vegetables as fruits. Most people, when they think about fruits and vegetables, they think primarily of fruits, and fruits are high in simple sugars. Even though they're good for us, we want to keep your blood sugar really, really balanced, and that's where cravings come from. So vegetables, they release their sugar much more slowly. They keep the blood sugar equal so that you have less of those cravings. So
any vegetable you like and as much of it as you want.
Exactly. Now we can get real specific and say one veggie has more of a sugar count than the other, but I like to make things simple. So twice as many veggies as fruits, eat as many as you want.
Okay. The third thing is to eat lean protein 1 to 2 times a day. So what is considered a lean protein, and what about portion size?
Okay. What I usually recommend with portion size is going to be 2 to 4 ounces. Now if you're a big football player or something like that, obviously that's changing. But the average person, 2 to 4 ounces. 2 to 3 times a day. You want the protein because protein, first of all, takes several hours to digest. And so you've got you've got chicken breasts, you've got fish, you can have beans, lentils, things like that that break down slowly, and that's also going to help build. What happens is if you deprive yourself of the protein, you're going to start losing muscle. And we don't want to lose muscle because obviously that's going to help your metabolic rate, it's going to help keep your energy up.
Okay, you're not completely eliminating dairy from this 10-day diet. You say, but to limit it to 1 serving per day. A certain kind of dairy, a certain size?
Yeah, I would say limit dairy. I usually get rid of it altogether, but a lot of people use cheese as one of their top protein sources. So we'll say 1 serving a day. I like mozzarella cheese because mozzarella is low in fat, higher in protein, versus all the other cheeses that are available because they're so high in fat.
So like the size of like a string cheese?
String cheese would be perfect. And if you don't want to do any dairy at all, I think that would even be better.
Even better. Yeah. Okay, this is where you get me. This is where I feel it would be hard. No bread or pasta. I could skip the pastry, cereal, or sugar. Okay, so what about, like for myself, I feel like I need some kind of a carb to feel good, or to not feel shaky, to feel like my meal is complete. So what's your suggestion there?
First of all, that's a typical response. Within 3 or 4 days, that will disappear. The reason most people have that craving for carbohydrates is because they're not managing their blood sugar well. So they'll eat when their blood sugar is low, and they need to jump it up. And the best way to jump up blood sugar is going to be sugar or carbohydrates. And that's why everyone loves donuts at 10 o'clock, because they had a crappy breakfast. And then at 10 o'clock, of course, they are craving more up, which is the sugar.
Well, it's interesting that you bring up the low blood sugar, though. So what if you do have low blood sugar and you tend to rely on having like a little piece of bread or some kind of carbohydrate to feel better? Well,
the reason oftentimes blood sugar becomes low is because of the habits of using sugar or carbohydrates to try to regulate it. You feel like crashing, you take something sweet, you bump up, you crash again, that's the yo-yo. If your body is given a consistent blood sugar through food, foods that break down slowly, within a few days, it's going to regulate much more easily. And it's actually going to self-regulate, so you're going to not have that need to start bumping it up.
So you may feel shaky for a few days, or is there something you can do to make that shakiness subside?
Most people won't feel shaky if they're eating 5 or 6 times a day.
Okay.
If they aren't, then they're going to feel crashed, and they're going to really have a challenging time staying on track.
Okay, the 6th tip, no eating past 7 p.m. What if you get hungry?
Then what I would say is always drink at least 1 or 2 glasses of water, because again, it goes back to, am I thirsty or am I hungry? And most people still aren't drinking enough. So if you wait 20 minutes and you're still hungry, then I would say if you haven't eaten your 2 to 3 servings of protein a day, then have a little piece of protein or some more vegetables. You can eat, just past 7 o'clock, it's like giving your body energy and then jumping into bed within 2 hours.
Okay.
You're just packing on more weight, which is harder to get rid of.
What if you don't go to bed till midnight?
Well,
can you push it to 8 or still you say 7?
I think we'll use common sense.
Okay.
Yeah.
All right. And then finally, walk 20 to 30 minutes every morning and night.
Correct. The goal is to start building a new routine. Now, this might not be a lifelong routine, but all the elements of what I've given here are something that you can modify and stay with long term. But the goal is people want to drop some weight so they can get into the bathing suit. And so the 20 to 30 minutes, you want to expend energy and you want to start getting your muscles being used to being used. A lot of people sit at their computer most of the day, so they're going to eat and then they're going to sit. And even though brain power takes energy, it takes less than when you're moving the body.
Okay.
So if you get the body ready, it's going to start burning and it's going to start using more of that energy.
Seems possible.
It's pretty easy.
Minus the no pasta and bread. I feel like it seems very possible.
Try it for a couple days, and if you're not feeling fabulous within 3 days, then call me and we'll talk.
Okay, well then you can call him. If you're a woman and you have a menstrual cycle, which hopefully you do, you know at some point in time you're going to experience cramping, bloating, maybe some severe PMS. So you pop a pill, kind of gets rid of it, but if you're looking for a more natural remedy, that's what we're talking about this morning with Dr. Nigel Brayer, who's a holistic specialist, chiropractor with Living Tree Center for Healing. It's great to have you on the show.
Thank you very much. Appreciate it.
First of all, what is it that exactly is causing the menstrual cramping that we feel?
Well, PMS itself is not a normal condition. So a lot of women experience it and they talk to their friends and of course they think that that's normal. Is painful menstruation to the degree of taking medication for pain relief is not normal. So most notably PMS is due to imbalance in hormones, most especially the estrogen and progesterone balance.
That's interesting to hear you say that it's not normal, because I would just think it's something that comes along with the cycle every month.
Sure.
And so we take over-the-counter pain medications, and is that really just hiding what's going on?
Yeah, it kind of goes back to the bigger perspective of the body's balance. So pain is not a normal occurrence in the body. So when something is out of balance, you're going to create pain. So estrogen and progesterone should be at a certain level at certain times of the month. And if those levels aren't correct, then you're going to have a delayed response. Now, pain, of course, is going to be the main symptom. So a lot of gals will take, anti-inflammatories or aspirin-based things or whatever. But what it is essentially is the uterus isn't functioning correctly because the uterus functions based upon the hormones that are surrounding and circulating through the body.
I mean, you can understand that for some people it's almost debilitating. I mean, there are young girls might have to call off school, or women may not be able to work because the pain is so severe, so you think, I'll take anything I can to feel better. But do you feel that there are some natural things that can be done to eliminate it for the rest of your life as long as you're experiencing a menstrual cycle?
Yeah, elimination is a hard thing to sell, honestly, but balance it and improve it is pretty much the big key. So there's a couple things that you have to ask whenever there's PMS. Is first, you got to figure out what's the balance of estrogen and progesterone. So that leads us to the next question: is things that can increase estrogen are generally going to be a problem, and that can be the foods that we eat, that can be the chemicals that we're exposed to. And so the liver, and I won't get too deep into the biochemistry of it, but the liver is going to be the detoxer of estrogen. So what I found is, or what they've found through research, is the best way is to clear the liver, to help the liver function. And so do anything possible with diet, avoiding alcohol, avoiding a lot of toxic type foods. That's going to help the liver. And then finding ways to increase progesterone. So naturally what we do in our office, of course, is to get to the bottom of that balance and start coaching people through how to balance those out, improve liver function, diet, exercise, etc.
Okay, so number one, think of liver. If your liver is functioning well and your liver is healthy, it's going to help a little bit with that cramping, bloating, PMS.
Correct. So things that you think about with the liver is we want lots of water. We want to avoid alcohol, we want to avoid soda, all those things that a lot of us consume regularly. Because the liver is not just cleansing you, but it's building other byproducts for the rest of your body. The next is avoiding fat, because fat in our body produces estrogen. That's why folks who consume a lot of fat or have a lot of body fat tend to have more PMS or worse PMS.
It's interesting though, why do we crave some of those things during our menstrual cycle as opposed to wanting to, I mean, you're saying avoid them and you may feel better, but you're craving them. So is that your body's way of saying that you want it?
Well, what it is when you have an imbalance in one thing, it affects an imbalance in the other. And so the pancreas is directly affected by estrogen and other things too. So what happens is when estrogen is high and progesterone is low, it can affect your metabolism of sugar. And so when your sugar drops low, everybody craves sugar. And then also our mood, since estrogen also has effect on the neurotransmitters in the brain, it also affects mood, and that's where depression comes in. It can also affect prolactin, which affects breast tenderness and those sort of things too.
Okay, so it sounds like a diet and exercise is really going to help long term. How long do you need to stick to a plan like this for it to kick in though? Like let's say somebody starts tomorrow.
Sure.
And they're very religious about it for a month, and then they get their period and the cramping is awful, and they think this hurts so much. I want to take something to make it better.
Well, in the short term, nothing when it comes to the body is short term, and that's why we're so attracted to the standard medical treatment for PMS, which is going to be antidepressants and birth control pills. They work quick, but they're still forcing a change. So really, it's going to be about lifestyle. Because PMS is another indicator of imbalances due to long-term small things that have accumulated. So you can see a change in a younger person like yourself in 2 to 3 months. In somebody 40, 50, 60, or not 60, but older ages, it's going to take longer because the cycle is more ingrained and more out of balance.
A lot of women will take birth control to help regulate their cycle, make the flow a little less heavy, and just kind of make things work a little bit better throughout the month.
Sure.
If somebody's going to start this program that you're suggesting, do you want them to go off of birth control, or can they kind of wean themselves off of it?
Well, again, part of my practice, I can't make that recommendation. However, is the premise of using a pharmaceutical is forcing a change. And we love it because it's quick and it seems easy, but that's still promoting more imbalance. From the natural perspective, we're always taking a step back and saying the why. Your body would be balanced, you wouldn't have the symptoms. And so when we force a change for a symptom outcome, it's going to have a recuperative or a repercussion elsewhere.